Hello everyone, welcome back to the channel. Now here we will see about the venous drainage of upper limb. The veins of upper limb contains the superficial and the deep veins. The superficial veins run away from the pressure points. They are absent in case of palm, ulnar border of the forearm, back of arm and over the trapezius. It is utilized for intravenous injections. The superficial veins of upper limb includes the dorsal venous arch, cephalic vein, basilic vein, median cubital vein and median vein of forearm. So first is the dorsal venous arch. As the name indicates, it is located on the dorsum of hand in the form of arch and it has following tributaries. First is the three dorsal metacarpal veins which are draining the metacarpals. So these are the metacarpal veins. Then first dorsal digital vein on the medial aspect of the little finger and one dorsal digital vein on the radial side of the index finger and two dorsal veins which are draining the thumb, and also the veins from the palm around the margins of hand and perforating through the interosseous space. From its medial end, the dorsal venous arch gives origin to the basilic vein, and from its lateral end, it gives origin to the cephalic vein. Now, the cephalic vein, also termed as preaxial vein, it corresponds to the great saphenous vein in the lower limb. It begins at the lateral end of the dorsal venous arch, then it runs over the roof of the anatomical snuff box. Here we can see this is the cephalic vein. Then it runs in front of the elbow just lateral to the biceps brachii tendon. Then it pierces the deep fascia over here, that is at the delta pectoral groove, and here it pierces the clavipectoral fascia and terminates in the axillary vein. The cephalic vein accompanied by the lateral cutaneous nerve of the forearm in the forearm, and in the hand it is accompanied by the superficial branch of radial nerve. Now at the elbow it is connected to the basilic vein via median cubital vein. Then we have the basilic vein, also known as the postaxial vein of upper limb. It corresponds to the small saphenous vein of lower limb. It begins at the medial end of dorsal venous arch. Then it courses backward, that is on the back of the forearm at the ulnar border. Then it crosses the ulnar border at the elbow. Then at the front of the elbow it lies medial to the biceps. Then at the mid of arm it pierces the deep fascia and runs below the deep fascia along the medial side of brachial artery. Then it is continuous, or we can say it terminates as the axillary vein at the lower border of teres major after joining with the venae comitants of brachial artery. This basilic vein is accompanied by medial cutaneous nerve of the forearm and the terminal branch of the ulnar nerve, that is the dorsal branch of the ulnar nerve. At front of the elbow it is again continued with the cephalic vein through median cubital vein. Here we can see that this dorsal branch of the ulnar nerve is accompanied the basilic vein on the dorsum of hand, and in this diagram we can see on the posterior aspect of hand and the forearm, although we see that basilic vein is longer, but actually cephalic vein length is more than the basilic vein. Now the median cubital vein, it is a large communicating vein connecting the cephalic vein with the basilic vein. It shunts the blood from the cephalic to the basilic vein. It is located in front of the elbow, that is in the roof of the cubital fossa. This median cubital vein, it begins from the cephalic vein 2.5 cm below the elbow. and it runs obliquely, upwards and medially, and ends in the basilic vein 2.5 cm above the medial epicondyle. It is separated from the brachial artery by this bicipital aponeurosis. This is termed as Lecertus fibrosis or the God's grace. So in this we can see the bicipital aponeurosis and the median cubital vein. So this is the bicipital aponeurosis and this is the median cubital vein. This one is the cephalic and this is the basilic vein. This median cubital vein has tributary like median vein of forearm. It is connected to deep through the perforator vein which pierces the bicipital aponeurosis. This perforator vein fixes the median cubital vein in its position. That is why it is the ideal site for intravenous injections. Then we have the median vein of forearm. This vein begins in the form of palmar venous plexus, that is the venous plexus which is located in the palm. Then it ends in the median cubital vein or basilic or cephalic vein. It may divide into median cephalic and median basilic vein in the absence of median cubital vein. So here we can see the termination of median vein of forearm. This is the median vein of forearm. Normally it terminates in the median cubital vein, but in case of absence of median cubital vein, it divides into two branches, median cephalic and median basilic vein. Median cephalic vein drains into cephalic vein and median basilic vein drains into basilic vein. Now the deeper veins of the upper limb. These includes the venae comitants of radial and the ulnar arteries, brachial vein, axillary vein. So the venae comitants, there are radial and the ulnar veins. These are accompanying the radial and the ulnar artery, as we can see in the diagram. This is the ulnar artery and this is the radial artery and this one is the ulnar artery. They are accompanied by the venae comitants on both the sides. At the elbow they unite to form the brachial vein. So here they form the brachial vein. These brachial vein accompany the brachial artery on both the sides. So here we can see the venae comitants of brachial artery. Then this brachial vein joins with the basilic vein at the lower border of teres major and forms the axillary vein. So here we can see this is the basilic vein and these are the venae comitants of the brachial artery and they are draining into the basilic vein at the lower border of teres major. This basilic vein along with the venae comitants of brachial artery, now termed as axillary vein. This axillary vein also receives this cephalic vein in the deltopectoral groove. Now come to the applied anatomy. This median cubital vein is the ideal site for intravenous access, that is for withdrawal of blood, for injecting the drugs and for cardiac catheterization. The reasons for using this median cubital vein for these intravenous access are: first, the bicipital aponeurosis separating it from the brachial artery. It is not accompanied by the cutaneous nerves. Also, the perforating veins piercing the bicipital aponeurosis fixes the vein and prevent it from slipping during piercing. Then we have thrombophlebitis, that is the inflammation of the vein. Then we have venography, that is the contrast X-ray or angiography of upper limb vein. Then we have cardiac catheterization. This is one of the invasive procedures used to visualize the heart's chambers, walls and great vessels in order to diagnose and treat the disease related to the abnormalities of coronary artery. For this we use axillary vein or basilic vein for inserting this catheter, that is the flexible tube. This flexible tube passes through the axillary vein, then through the subclavian vein, then it enters into the superior vena cava, which is opening into the chambers of the heart. So in this way we can enter into the interior of the heart through the veins. This is the cardiac catheterization. I hope you understand well. Thanks for watching.